four basic principles of modern medical ethics that can help us to not just solve the moral issues what we can meet during the clinical cases and medical care, but they can help us to identify that there is a moral issue what we have to deal with.
Welcome to Caring and Sharing, the Advanced Oncology Podcast. My name is Uta Schmidt-Straßburger, and I'm meeting Beáta Laki today. Dr. Laki is a bioethicist of the University of Pécs Medical School. She studied philosophy and also gained a true PhD in this subject. We met on the occasion of the European School of Oncology masterclasses for clinical oncology and of the European Oncology Nursing School. Beáta is discussing clinical cases there because she's really interested in clinical case-based scenarios, which is why I think we should talk to each other more often. Welcome.
Thank you for the invitation. Welcome.
I thought of you recently when I read an obituary of Tom Bouchon, one of the fathers of basic principles in applied ethics. Would you like to elaborate more what those principles are and maybe what relation you have to the theories of Bouchon and Childress?
Thank you for the question. Bouchon and Childress created the basic principles of modern medical ethics in the 1980s, exactly in 1978. And since then, they renewed 7 times, if I remember well. And these works, or this book, contains the 4 basic principles of modern medical ethics that can help us to not just solve the moral issues what we can meet during the clinical cases and medical care, but they can help us to identify that there is a moral issue what we have to deal with and how we can deal with them. And these principles are the following: the respect of autonomy, the do not harm principle of beneficence, and the justice. Not just from my point of view, but as we can see it in the clinical practice, they are necessary to be identified in order to handle the patient well, and not just focusing on the physical symptoms, but ensuring that the patient gets that support and that care in this medical caring process, what is needed.
I think this is particularly important in oncology, where there are often conflicts of interest, be it the continuation of a treatment that might not be beneficial or evidently beneficial for the patient, or where there might be financial constraints. There are inherently very often also family interests and contrary to the personal interests of the patient. And of course, there might be a personal interest also from the side of the healthcare provider. So I do think it is very important to discuss these issues and to moderate discussions in the clinic. Do you teach these principles as part of the standard curriculum for the medical students in Pécs?
Yes, I do, because these principles give us and give the students and future doctors a toolbox, what is necessary and helpful in these cases, because with the help of these, they can identify all of the parties and all of the interests and the opposition that can appear during the patient care. And from my point of view, these are trying to outline the main parts of the issues what we can face.
Mm-hmm. And how much exposure do the students get when they are studying these issues with you? So how long is such a session that you are teaching in general? Because our studies here in Germany, they take like 5 year of a curriculum plus the 1 year of practical experience. In total, we are talking about 6 years. So how much time of those 6 years is being spent on medical ethics?
Unfortunately, not as much as I would like to. They have a compulsory course, bioethics, medical ethics, only for one semester. And we meet 7 times for 90 minutes with the students, but in small groups, in 2024 participants group or members group. During this, I had the opportunity to define the basic notions and principles, and this is the first half of the semester. And the second half of the semester, we are dealing with cases and specific topics that try to introduce the nature of the medical ethics. For example, what do we have to do, or how we should think about justice and justice-related issues. For example, in case of COVID-19, when we have shortages of resources, not just the human resources. I don't like saying human resources or using human resources as an expression, because the medical staff is not a resource. They are members and human living beings who help us to survive. And the other part or other topic of the semester connects to end-of-life issues, which focuses on the individual decisions and individual decision-making issues, which can be in opposition, of course, with other stakeholders' interests and duties. For example, with the duties of professionals, the medical care, because they would like to lengthen the patient's life, but decreasing the suffering and pain, etc. But sometimes it is in opposition with the desire and intention of the patients who don't want to live longer because this condition or these conditions don't meet with their definition of quality of life and self-moral status. The third and not the last topic is connected to the nature of medical ethics, which is about the scientific progress. And here I like to talk about genetic interventions and CRISPR-Cas9 technologies, which shows the ongoing and fascinating process and progress of technology, of what we have to deal with in the frame of medical care, because these technologies are here. And we have to support the technological development, but at the same time, we have to represent the patient's interests and following the rules and regulations what are set up in the clinical terms.
It seems that this is a topic that has been following you for a while. What about your thesis? Maybe you should share with the audience what your thesis was about, why you're so into this topic, which I think is very relevant and very actual these days. So it's very present. And I think there's probably not a week that's going by without a new advancement or a new report about the mentioned CRISPR-Cas technology. And I do think there are some caveats, and of course, it needs to be discussed on a case-to-case basis. But maybe you just share your thesis title.
Yeah, sure. Thank you for the question. I wrote my thesis in 2019, and the title was The Moral Issues of Human Enhancement and Transhumanism. To be honest, the core topic was genetic interventions, and since then I'm dealing with this topic, and I just can see a kind of evolution of not just the knowledge, but the process and the method how I deal with the genetic interventions related topics, because we can see many different approaches how we can get closer to these issues and what kind of effects do the genetic interventions have, and how do we have to think about the not just the importance but the consequences of these interventions. What I mean, for example, when we think about the German genetic interventions that can cause heritable changes in the germline, we have to identify the pros and cons. Why is it beneficial for the patient, the future patient, the embryo, which will be implanted into the womb of the mother in the future, because the newborn kid won't have disease, and he won't inherit it for the future generations, but we intervene into the genetic line of the humanity directly, and we have no idea about the long-term consequences of it. So here I'm just talking about the health-related issues, but when we think about the enhancement part, how can we improve our abilities and capabilities with the help of science or the support of science? Are we able to do it? Do we have to do it, or are we allowed to do it? So many questions can we formulate, and issues, of course. And these days, although we have the CRISPR-Cas9 technology, I'm strongly on the part using it on a somatic level, which is not heritable, which don't cause heritable changes, but we can handle so many diseases. But the germline genetic interventions are too insecure. I mean, not the technology, but the long-term consequences in connection to the humanity, the next generations, and how we should define the disease in the future, not in our lifespan in the next 30, 40, 50 years, but 100, 200 years later. And we have no idea what will happen and what kind of genetical traits are beneficial or not. So it is risky to intervene into the genetic line so deeply and so severely. And as you can hear it, I'm really enthusiastic in connection with the genetic interventions and the human enhancement.
So I'm from former East Germany, and I do think that there was some enhancement of humans with regard to sports. So the question is, where does it start? Where does it end? And how much of this is legal? How much of this is acceptable? And I do think that every society needs to define their own limits. And I think it is something that we need to find out in each society, and probably the ideas of what's okay and what's not okay may differ from one context to the other. And I do think also of the cloned sheep, Dolly, in the 90s. So I think that was the start where people were thinking even more about genetic interventions. And there we had the entire challenge of the telomeres, so that people who would be generated from a cloned stem cell might have shorter telomeres. This means that they might be more susceptible to diseases. However, this technique is still in full application for research with regard to induced or inducible pluripotent stem cells. And I think this is a very relevant model system to study diseases and disease progression. So I really think each of these systems has their place in research. But the question is, of course, and this needs to be answered by several stakeholders from society, whether it will have place in society in general, and whom shall we serve with this technology. So as a biochemist, I'm quite familiar with hereditary conditions of newborns, because this is quite relevant in biochemistry, and the postpartum testing of newborns for several metabolic deficiencies is tightly linked to exactly the enzyme equipment of the newborn. And so, of course, we need to consider these aspects as well when counseling parents and patients, if they make it to the age that they can make their own decisions.
I totally agree with it, and it is interesting how we use this information in the future and what for we use it. So we can use it for, of course, beneficial reasons, because we would like to give advices for the future parents, what kind of issues they have to or they will probably face after the birth of the newborn. But we have to be aware of the power of information, what we can collect from this. This is another big issue, not just data protection, but the discrimination-related issues as well.
I totally agree with you that potential discrimination is something maybe all people will have common noses. The question is how much of this is really necessary, reasonable, and tolerable for society.
Yeah, exactly. And one more thing about the differences between societies and societies, because we have different value system. Value systems, we are different levels of acceptability connected to the application of certain interventions. But fortunately, for example, if I can turn back to the more basic principles of medical ethics, we have something common worldwide, although it is said as an American bioethics, which is within the boundaries not just for America, but European and worldwide. So we have something in common how we can think about what is necessary, acceptable, and what is not or should be permitted.
Well, that's very interesting and inspiring. And I would like to talk longer about the different topics, but I don't know whether our listeners would appreciate that. Maybe we'll call it a day for now. Thank you very much for joining me this morning, and I hope you have a great week. And I'm looking forward to seeing you again in person during the ESO Masterclass in Clinical Oncology in San Sevolo this autumn.
Thank you. I'm waiting for it. Thanks. It was my pleasure. Bye.
Bye.